You may have heard about the recovery to practice model and are familiar with diversity, but you're uncertain about how the principles of recovery connect with diversity. As we have learned in previous modules, it is important to look at people individually in the recovery process. Each individual has their own individual path to recovery. However, it's important to examine how one's gender identity, and race/ethnicity can impact the recovery process. To examine how gender identity, and race/ethnicity may impact the recovery process, we will examine how they impact each of the 10 guiding principles of RTP. We now will cover each of the 10 guiding principles one at a time over the course of 2 videos. We cleverly call them Recovery Principles and Diversity, Parts 1 and Part 2. These videos are a continuation of the Intro to Diversity unit of the Recovery to Practice series. They're all connected, but don't worry if you watch them out of order. Just find the topics you're interested in now, and keep in mind the others will still be there as you need them. Hello, I'm Dr. Richard Hofer from the University of Texas at Arlington's School of Social Work. With gratitude for the support of the Hogg Foundation for Mental Health, I'm presenting information to help you learn more about the concepts of the recovery treatment movement. The purpose of this training is to advance the goal of the Hogg Foundation Recovery to Practice grant program. We seek to enhance the implementation of recovery-oriented practice among social workers and other behavioral health practitioners through participation in comprehensive, discipline-specific training. This video is helpful to anyone interested in learning about improving mental health services through the recovery approach, whether you're still a student or an experienced practitioner. Let's look at what the 10 principles of RTP are. Up at the top, we start with hope. We also know that the RT principles are person-driven. There are many paths. It's a holistic approach. Peer support is used. Relationships are vital. Look at client culture. We address trauma. We focus on strengths and responsibilities, and underlying everything is respect. In this video, we look into each of the first 5 of the principles one by one. In Part 2, we'll examine the last 5. First, let's talk about hope. Hopefulness may promote healthy behaviors or minimize unhealthy behaviors. Hopefulness has been found to be related to mental and physical health. Conversely, the lack of hope, or hopelessness, has been shown to be associated with depressive symptoms, poor health, and suicidal behavior and ideation. Hopefulness is particularly beneficial in the face of persistent stressors and adversity across the life course. But how may one's identity impact one's ability to feel hope? Generally, research is mixed on how gender, identifying as male or female, impacts one's ability to be hopeful. Some studies find that being female is associated with having higher levels of hope than being male. However, other studies find that hope is unrelated to gender. One consistent finding is that hopefulness is related to fewer depressive symptoms for both males and females. Hope is an especially important topic in the recovery process for LGBTQ and transgendered people, and particularly for LGBTQ youth. It's critical that queer adults provide hope for younger persons by showing that queer adulthood is markedly different from the extremely painful experiences of adolescence. Hope is centered on the message that it does get better. Youth often can't picture adulthood, and thus messages of hope for the future is critical for them to hear. What about the connections between hopefulness and race? Well, we find there are mixed research results. Some research studies find that there are racial and ethnic differences in levels of hopefulness expressed, with whites reporting the highest levels of hope. However, other studies find no differences in level of hopefulness by race and ethnicity. Hopefulness is associated with health benefits for whites, but not Hispanics. Greater levels of hopefulness are associated with health benefits for blacks, especially for those who experience major acts of discrimination. Thus, it may be important to assess acts of discrimination experienced in discussing hope as an important principle of the recovery process. The second principle of RTP is that it's person-driven. Individuals make their own choices and are empowered to take charge of their own health. Since individuality is a main component of person-driven care recovery, each person is viewed as unique. Thus, one's gender, gender identity, and race, ethnicity are always considered. Patient-driven recovery is important for both men and women. However, it can be especially empowering for women who traditionally experience less power and more subordination in their roles in the workplace and at home. Patient-driven recovery may also be particularly important for people of color, as it provides them with a strong voice in the decisions regarding their own health and wellness. A personalized plan is created for each individual, so a person's values, needs, and views are incorporated into their recovery process. Part of providing person-driven care with LGBTQ population is to make the invisible visible. Intersectionality is important to keep in mind. Individuals have the right to decide and explore their sexual orientation and gender identity, and one's sexual orientation and gender identity can be fluid and change over time. Individuals should never be forced to disclose their sexual orientation and/or gender identities. For example, when women are asked if they have a husband and men are asked if they have a wife, and only provide two options for gender, male or female, it can be painful for those in the recovery process. An important principle of RTP is that there is no one specific correct path to recovery. Individuals find their own paths. Are there differences in the paths that men and women take, for example? We do know that women are more likely than men to engage with complementary, alternative medicines and varied pathways to health. Men are more likely than women to rely on their doctor's advice. Women are also more likely than men to research the pros and cons of the various alternative paths. We also know that young adults are more likely than older adults to use a diversity of complementary and alternative modalities in their recovery process. The use of herbs, massage, chiropractic, relaxation techniques, and vitamins being the most commonly used by more younger than older adults in recovery. Men are less likely than women to visit a nutritionist as part of their health care and recovery. Hispanics have been found to use complementary and alternative medicines more often than whites or blacks. Blacks are least likely to use any complementary and alternative medicine, but often embrace prayer as a modality in the recovery process. Another principle of the RTP approach is that it is holistic. A holistic approach to recovery means to provide support that looks at the whole person. The support should also consider one's physical, emotional, social, and spiritual well-being. A holistic approach focuses on a person's wellness and not just their illness or condition. Holistic modalities to recovery are the cornerstones of both physical and mental health care for people of all genders, races, and ethnicities. In looking at addressing recovery from a holistic perspective, it is important to look at a person's various identities. Recovery is most likely to occur when one's various identities and how these identities have impacted the health and well-being of the person are considered in the process. In assessing one's various identities, we use intersectional theory. It recognizes individuals' various identities and the stigmas associated with those identities. People living with mental behavioral health diagnoses, substance abuse challenges, non-conforming gender identities, non-heterosexual orientations, non-white ethnicities, low social economic status, and physical disabilities or challenges experience marginalization. Recovery processes that address only one identity and thus one stigma, rather than looking at the person holistically with multiple identities and multiple stigmas associated with those identities, are likely to have less success. Another important aspect of the recovery practice approach is that we use peer support. Now, we know that there's a relationship between peer support and the recovery process. Although we generally view peer support as positive, at times peer support can be negative. For example, peers can condone or even encourage the use of violence at times. However, in Recovery to Practice, we focus on the importance of positive peer support, and we know that there are some differences in the benefits of positive peer support among people of different genders, ages, and races. Generally, females are more likely to receive peer support than males. Females are generally more likely than males to reach out to peers and maintain stable relationships with their peers. Females are also more likely to benefit from higher levels of peer support than males. LGBT and transgendered people especially benefit from peer support. Peer support is particularly important to adolescents as they struggle with the transition into adulthood. In fact, some research finds that peer support is more important to positive mental health among people under 30 years than in people of older age groups. Peer support has also been found to be important and beneficial among people of various races and ethnicities, and those with ethnic racial centrality have higher initial levels of peer support than those whose ethnic or racial identity is not central to who they are. In this video, as we come to a summary and closing, we've covered 5 of the 10 principles of recovery to practice. We've looked at hope, person-driven approach, the many paths tenet. We know it's holistic, and we know that peer support is vital to making it work. In our next video, we'll examine the last 5 principles of recovery to practice: relationships, culture, addressing trauma, strength and responsibility, and respect. In the following slides, you'll see the resources that you can use to learn more, and also the references that we have in order to bring you the most evidence-based information.